one of the big issues, and is going to remain one, is health care. You're one of the few who realize, even though it's a different industry from others, every industry is different, but the principles of free markets, if allowed to, would work. Can you cite what you've done, what you could with Whole Foods in terms of bringing consumerism into healthcare instead of just having it all third party, which doesn't work?
I will. We created this system about a decade ago. We created a system where we created a high deductible plan, and now that deductible is about $3,000. And that, if you work for our company, you're automatic, and you work 30 hours or more, you're automatically enrolled in the plan, which is about 75% of our team members are full-time, 30 hours or more. And the part-timers can buy the plan if they wish. And this, you're automatically enrolled, and then it's a high deductible plan with a $3,000 deductible. But we give up to $1,800 every year to our team members into either a health savings account or a health reimbursement account. We just call it a personal wellness account. They can use that for their deductible if they have any health care expenses. In any one year, most of our team members make no health care claims at all. So they just pile up the money every year, which is good because when they do have a problem down the road, they'll have plenty of money in that account. But then when the deductibles exceeded $3,000, then Whole Foods Market begins to pick it all up. It's very popular with our team members. It works very well. The premiums have stayed very low. Of course, under ERISA, it stayed very low. And now that we've got healthcare reform, we're going to see lots of lobbying going on. A great example of that is in vitro fertilization. In Massachusetts, where we had Obamacare, and the lobbyists were able to get in vitro fertilization covered, it raised every health insurance plan in Massachusetts $850 a year, just by that one mandated benefit, of course, which isn't a health condition at all. I mean, I can see why people want to do in vitro fertilization, but that's not the same thing as a heart attack or cancer or diabetes. And by forcing everybody to cover that, it raises the cost to every individual that's in the plan. And that'll force some people to have to, or some companies or some individuals to not be able to afford insurance anymore on the margin. So in our case, we have this great plan. Our team members love it. It's worked very well for us. And now, of course, we're worried about it. We're worried that they're going to force us to cover in vitro fertilization. They're going to force us to cover mental health coverage or alcoholic rehabilitation or drug rehabilitation or acupuncture or chiropractic or any of the hundreds of mandated benefits that our team members may not wish to have if they knew it was going to raise the cost of their premiums, and therefore the amount of money we can pay in wages will be affected ultimately. There's only so much you can pay.